How well do you know the children in your service? It's really important to understand the needs of the children and young people in your care because it's the best way to keep them safe. How can you do this? You should receive a handover when the child comes into your care. This is a chance to hear firsthand about what the child needs, both in a long-term sense, as well as anything that might already be going on for them. Read the child's recent case notes. These might also be known as shift notes. Use information gathered from the child, their care team and family, through intake and case planning processes to make sure services best match the needs of the child. It's also very important to regularly review the child's needs. Be sure you read the child's behaviour support plan, sometimes called a BSP. This is a really important document created by people who know the child well, which describes their needs, their usual behaviours, and how to support them and keep them safe. It's important to try and understand the impact of the individual child's disability or disabilities, including the risk and vulnerability factors faced by the individual children you care for. You should consider their communication needs, dependency on others for support, understanding of appropriate and inappropriate relationships. The more you can understand, the more you'll be able to support the child to communicate with you. This means they're in a better position to let you know if they have any concerns about something that's happening to them that they don't like. It also means you're able to work with them so that they're living to their full potential. One way to encourage children to communicate is to help them understand there are things around them they have a choice about. This can include what to wear, what food preferences they have, where they would like to go on outings, and which friends they associate with. Allowing them input into all these choices empowers them to feel more comfortable about communicating other concerns. It's really important, where possible, to include the child's family in conversations about the child. Speak to them and the Child Support Network to better understand how to help the child to participate and communicate and express concerns or seek help. Families usually know the child best and will be able to let you know what works well and what doesn't. Want to know more? Remember, if you're concerned that a child is at risk of significant harm, you can contact the Child Protection Helpline at the Department of Communities and Justice on 132 111. If you're a mandatory reporter, you should refer to the Mandatory Reporter Guide on the Department of Communities and Justice website. To learn more about keeping children and young people safe in specialised substitute residential care, have a look at the Code of Practice. Read the OCG's Guide to the Child Safe Standards and the Specialised Substitute Residential Care Handbook. Complete the OCG's Child Safe Self-Assessment to find out how you're doing and to be sent specific information to support your child-safe journey.